One of the scariest parts of this epidemic is the unknown.
There is not a lot of good information right now.
So little is still known about the real risk to pregnant women.
I just try to forget that I'm pregnant while I'm at work, honestly.
I kind of honestly feel like if I haven't already had it, I'm going to get it. It's kind of just a matter of time. I put up that photo of myself and my colleague, Annie, and I posted it because as this coronavirus pandemic was starting to unroll before us, there just seemed to be a moral dilemma emerging between the obligations you have as a mother and as a pregnant person versus your obligations you have as a physician. I really was just grappling with the thought of how do you balance these competing obligations.
There was really an exponential rise here in New York in terms of the number of cases. And my last few weeks of work correlated or corresponded with the very beginning of that rise and that uptick. You know, as an emergency physician, we are used to being on the front lines and interacting very intimately with the public. And so I think as a part of my job, I have probably a higher threshold for risk and presume that I will be exposed to many things. But this kind of brought a whole new level of uncertainty and fear.
I think that's a concern that never quite leaves. Whether I was pregnant or not, and especially now that I am pregnant, absolutely magnified. Comfortable as I am, and with all the experience that I do have clinically, this is still an evolving virus, and we are still, as physicians, learning how to best treat our patients and protect ourselves as well. And certainly now added to that would be a pregnancy.
Labor and delivery is frontline, but it has some unique intricacies that make us different than the emergency room. Our patients have a high incentive to present healthy, so to present without symptoms and without fever. And there's a lot of fear for patients about losing their support person during labor or having recommendations that they're separated from their baby. So that creates a lot of incentive to maybe hide those symptoms. So what makes me feel safe would be an N95 mask for every delivery. And that's just not something that we've been provided yet. I know we're in short supply. And a big part that makes us unique is when we do deliveries, I'm just within a couple of feet of a mother who's forcefully breathing, trying to push out new life. And I'm putting at risk both her and her baby, and she's putting me and my baby at risk.
A lot of our physicians employed by a company outside of the hospital that contracts with the hospital. So I'm not technically a hospital employee, so I don't, that I know of, we don't get any paid maternity leave. So we have to, take time off. So it's definitely made me feel like I need to work longer because I don't want to, for one, I don't want to be gone too long and have my coworkers be, stressed with having to cover more shifts from me not being there. That along with, the fact that it's unpaid, so that's definitely a factor that goes through my head.
So what brings me to work every day is thinking about my patients. As a pregnant healthcare worker, I know there's an added layer of fear right now and unknown. And so I just love walking in the door and seeing the relief of them having someone they recognize in such a scary, unknown time.
This has been my life's work. This has been what we have been trained for. We have trained our entire lives to be in this moment. And it is my duty, my obligation, and my honor and privilege to be able to help those who are suffering. And if I can offer that, then I will have done what I've set out to do.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.